we had 3 speakers in the morning session, and 3 of them were gem of homeopathy. And they have years of experience as practitioners, as well as they are all wonderful teachers. And we are so lucky to have them here. First, let me talk about Dr. Santosh Kumar. His presentation in the morning on arsenic album LM Potency in pediatric asthma and its cytokine dynamics is a perfect scientific study, and which he has completed as a part of his PhD, and this is a great academic advancement of homeopathy. Thank you, Dr. Santosh, and it was a wonderful presentation, and this will encourage the new generation to take up the research into higher levels. Thank you so much. And Dr. Shashikant Tiwari, and he is not only a teacher, but he is a great practitioner, and his exposition of Boger's Repertory and how to use Boger's Repertory is a fantastic tool in homeopathy in many occasions, and there are many few people who use it regularly. And it was inspirational for everyone, all of us, to rethink about Boger and how to use the pathological as well as the concomitants for the prescription and the best results. Thank you, sir. Thank you so much. And we have our third speaker, Dr. Samir Rafai, and the 4 cases he has presented has really enlightened us. And seeing like a complete cure in a proper way is something which gives us the insight, bravery, as well as courage to practice homeopathy forever without an iota of doubt. And thank you everyone. Thank you very much.
I request Dr. Nishikant Thape, Dr. Rajendra Singh sir, and Dr. Sudhanshu Arya sir to come onto the dais for felicitating Dr. Jamir sir. Now I request Dr. Shashikant Tiwari sir to come onto the dais. He will be a chairperson for coming up 3 sessions. Please come, sir. Now I request Professor Dr. Naveen Pavaskar sir to come onto the dais. So Dr. Naveen Pavaskar sir needs no introduction. He is currently Director, JIMS Healthcare, JIMS Homeopathic Medical College and Hospital. He is health consultant for 40 plus organizations in India and abroad, and has got vast experience as a teacher, as well as experience in disaster and emergency management, and also administrative experience, various boards and committees as a member, and he was a hospital-based clinical experience, public health experience. So, now currently he is the member, expert committee, National Commissioner for Homeopathy, New Delhi.
Homeopathy in acute viral hepatitis, a prospective descriptive study. Dr. Naveen Pavaskar is a very good speaker. He was there with me yesterday in Belgaum. We both had some conference in Belgaum and we came together. We shared a lot of things, and he has very scientific mode of thinking in homeopathy. So learn from him the methodology of working out cases and the involved thinking and logic. That is the main thing you have to learn from him. So Dr. Naveen Pavaskar, it is over to you. 40 minutes is for you.
So I'm going to talk on efficacy of individualized homeopathy in acute viral hepatitis, a retrospective descriptive study. So acute viral hepatitis is a diffuse liver inflammation caused by hepatotrophic viruses, namely hepatitis A, B, C, D and E. When we say there is hepatotrophic viruses, there are other viruses which are essentially called non-hepatotrophic like HSV and other viruses as well. So we are going to now talk about these five, the study of acute viral hepatitis based on the infections of these five hepatotrophic viruses alone. Just to revise, the mode of transmission varies. For HAV and HEC, it is feco-oral. For others, it is percutaneous, perinatal and sexual as well, and transplacental. Now, it's important to understand the incidence rate. You can understand this. It's more predominant in Asian and African countries. Those red and yellow areas are where it is more predominant, and the blue ones is where it is on the decline. In studies published between 1990 and 2019, Asia had the largest absolute incidence number of acute viral hepatitis among all 5 continents in the world. In 1990 to 2019, HAV, that is hepatitis A, and HCV infections were highest, and over a period of time now, HBV and HEV is on the rise. HAV infection, that is hepatitis A and E virus infections, are predominantly acute presentations, while HBV, HCV and HDV have both acute and chronic presentations. Typically, there will be a prodromal symptom followed by low to high grade fever, dark colored urine, clay colored stool and and there will be then followed by clinical jaundice. Clinically, there are prodromal symptoms of nausea, vomiting, fatigue, malaise, myalgia, headache, photophobia, extra liver symptoms like arthralgia and even coryza. I think this picture gives you enough idea of what it's a multicentric syndrome that comes into picture when you talk about acute viral hepatitis. Now, here's what I'm trying to tell all of us is to understand the anatomy, the histology, understand the pathophysiology, and then understand the clinical picture. When you put these 3 things together, it is called clinico-pathological correlation. So when an acute viral hepatitis sets in, it essentially is a diffuse inflammatory process involving mainly mononuclear cells and early ballooning and degeneration of hepatocytes. Now, this is where essentially your blood parameters start changing, and then you will have to understand this is the time when there is a prodrome with fevers, rigors, malaise and all other things. This is you will not see an icterus at this point of time, but you will see all other blood parameters rising. Then the second level comes up where there is acidophilic degeneration of hepatocellular and there is hepatocellular necrosis, cell dropouts. This is where your SGOT, SGPT will rise to the peak and bilirubin will start leaking into the system. So if you are trying to look at bilirubin at the beginning of the syndrome, you will not find it. Then there is something called bridging necrosis or a confluent necrosis where the necrosed cells join together, and this is where you will see deep jaundice and ballooning bile obstruction, and you will get symptoms of malabsorption and malabsorption of fat. By this time the fever has already receded. So this is the time when you will see that bilirubin rise but the other parameters fall down. And finally, when the reticular network, the protein network within the liver breaks down, and that is the time when you will see all the parameters decline but the general health of the patient deteriorates. Weight loss will be there, there will be lot of icterus at this point of time, and then there will be malabsorption syndromes. Now, for you to understand clinically what is happening inside the liver as a pathology, we don't have to really open up the liver and see with every patient. What you need to understand are the markers that are there. So normally when a patient of hepatitis comes, you should be ordering CBC, SGOT, SGPT, alkaline phosphatase, serum bilirubin, prothrombin time, serum albumin and serum ammonia, of which each has a different significance. Like what does CBC tells you? It tells you whether it's just a viral infection or there's going to be a superadded infection as well. SGOT is a marker of early marker of hepatocellular injury. SGPT as well is an early marker of hepatocellular injury. Alkaline phosphatase is a secondary marker. It's not a first time marker. It's a secondary marker of cholestasis due to hepatocellular injury. And serum bilirubin, which essentially is taken as the marker, is actually a secondary marker for metabolic degeneration caused due to leak and damage of hepatocytes. So if you want to really find out the early changes in the liver, you should look at the SGOT and SGPT and not at serum bilirubin. Whereas if you see prothrombin time, serum bilirubin, albumin and ammonia are indicative of derangement in the synthetic function of the liver. Liver synthesizes with prothrombin, albumin, and if you see ammonia being on the rise, it means the metabolic function of the liver is completely deteriorated. So when you order these investigations, you should also know what to interpret out of them. Just ordering them as a stack is not important, but each of them vary and with the timeline, and this is the timeline that you should keep in mind. You can see the gray line and the brown line indicates the peaking of SGOT and SGPT, which actually happens much before the bilirubin starts rising. The yellow line is indicative of the rise and fall of bilirubin, and the gray line that you see in between is actually where the cholestasis happen, and you will see alkaline phosphatase sneakily peaking up and then falling down. So why am I showing you this slide is when you understand the pathogenesis of any disease, please understand that it is marked on a timeline. It is not a static phenomenon. So if you don't understand the timeline of how this pathogenesis is going to progress, you will not understand how to interpret the investigations and correlate it with the clinical and pathological symptoms. So if you are in the initial part, if your patient is reporting to you in first 24-48 hours, and if you do a serum bilirubin, you may not find that it is on a rise, and you might misunderstand it saying that it is not an case of hepatitis. But if you have coupled it with SGOT, SGPT, and if that's rising and if your serum bilirubin is not rising, don't panic, it is going to rise after 3 or 4 days. So you should know what investigation and when to time those investigations. And that's the whole study that we are going to talk about. I think as laboratory features, SGOT, SGPT levels rise initially, followed by serum bilirubin, and which is both the conjugated and the unconjugated factor, and then rises the alkaline phosphatase in between and falls very rapidly. If there is a rapid rise and fall of SGOT, SGPT, if there is a steep rise in bilirubin, and if there is fall in serum albumin and rise of ammonia, you know that you are in soup. So this is a red flag that you should know very, very clearly. If there is rapid rise and fall of SGOT, SGPT, please mark my word, rise and fall, not just continuously rising. If there is steep persistent rise in bilirubin, if there is fall in serum albumin and gradual rise in serum ammonia, you are clear that you are heading for a yellow atrophy of liver, and that's amounting to death. So please understand that these factors, it's not just important, again I am saying, don't just order your investigation, know what is your baseline, so your day 1 investigation, and then know how to follow it up to understand the clinico-pathological correlations that are happening in the case. Why does a homeopathic doctor have to know all this? We are not symptom hunters. We have been labeled as symptom hunters, but we are not. We have much more to offer and understand if we understand the clinico-pathological correlations. Now, it's important to also understand what is the natural clinical time and recovery of a patient. So for an HIV acute infections, it's usually 1 to 2 months. So the average time for a complete recovery, if it is not attended, or if you only give a supportive therapy, which is what modern medicine does, it's around 8 weeks for a complete recovery to happen. And for HBV and HCV, it is around 16 weeks, where if it is uncomplicated, it recovers in 16 weeks. Now, in Asia, hepatitis A had the highest age standardized mortality as well. So please understand, hepatitis A can be a killer. Don't take it into a very light stand. And if you can understand, there are risk factors that involve relapse, not mainly in HIV and HEV, but the other HBV and HCV relapses and transforms into a chronic hepatitis, or eventually can lead into cirrhosis and even the cancer if it is not treated well. Please understand, case fatality is around 1%. 1% is a very high number from medical standards. And if there are other comorbidities, it can go up to that level as well. Now, what does this study is all about? It's a retrospective study as well. All subjects had reported with clinical symptoms of hepatitis. The ratio was 46 to 58 and pediatric as well as adult to pediatric subjects. What was the clinical method followed? They reported as early as on the second day and as late as on the third week. So the symptomatology moves from second day, as early as on the second day, to the third week as well. SGOT levels at the time of reporting were around 200 to 1500 levels. Now, the clinical method was very simple. A single indicated homeopathic medicine was administered to everybody. Single in the sense what was indicated and individualized. We did not give one medicine to all. Whatever was indicated and individualized was advised to everybody. No other treatment was prescribed. Dietary advice was given. Advice to rest at home, and only 1 or 2 cases required admission. And we monitored the biochemical parameters on the, based on the periodic ratios. Now, it's important to understand, that's what I said. We compared that if you leave it alone or just give a supportive treatment, the complete clinical recovery takes around 4 to 8 weeks. 83% of the patients who reported in this particular study recovered in 2 weeks, and the rest of the 17 recovered in 4 weeks. 17% recovered in 4 weeks. What does it tell us? We've cut down the course of illness by 50% by using homeopathy against not using homeopathy. Now compare this with time to recovery published reports. Time to recovery, spontaneous recovery with supportive therapy, minimum time required is 4 weeks, max is around 8 weeks, so average is around 6 weeks. Recovery with homeopathy, where you have changed the course of illness. By recovery, I mean recovery of symptoms, recovery of signs, recovery of all the blood biochemical parameters as well. We brought it down by half, and this is the chart which tells you how the cases recovered with the help of homeopathy as against when they are not used, when the homeopathy is not used. Now, when we talk about homeopathic recovery, it has to start with general symptoms. If generals are not improving, you can be sure that your recovery is not on the right track. So whenever you are doing your research studies, make sure that you find that you actually figure out which symptoms are expected to recover before and which symptoms are expected to recover later. In this case, you can see that 89.6% of people's general symptoms recovered within 0 to 2 days. That means within 48 hours, their general recovery was registered. And within 2 to 4 days, around between 2 and 4 days, the rest of the people also recovered. General symptoms should follow by particular symptoms. So your recovery chart when you are doing in your research studies should not be just about 1 or 2 markers. Most of the times we look at couple of markers, which is good, but if you are able to look at how we have altered the course of disease and provided a general symptom recovery followed by particular symptom recovery followed by the changes in pathology, that would be a right way of demonstrating how homeopathy is able to alter the course of disease. So if you can see, within first 2 days, 89% of general symptoms recovered, but it took only 55% recovered in particular symptoms. So general symptoms followed by particular symptoms, and within 2 to 4 days, almost all of them recovered. So time taken for serum bilirubin to reach normal. Now that's the third biochemical parameter that we are using at. So when you're looking at homeopathic case recovery, you should look at general symptoms followed by particular symptoms followed by the biochemical parameters. If you see this, the graph is very absolutely different. In first week, only around 14% people showed serum bilirubin touching normal. But by the time it was second week, it reached around 70%, and by third week, it reached around 75 to 80% of people. So you see, general symptoms give you a guideline that you are on the right track. If your general symptoms are followed by particular symptom, you are confirmed that you are absolutely on the right track. And then if you see gradual fall of your biochemical parameters, you need not force your change of act, you need not change your course of action. So this is what the whole idea is. When you design a study, make sure you take the philosophy of homeopathy into consideration and demonstrate that at each level homeopathy is able to impact the study. Now, the approach was very, very simple. I think Tiwari sir had already spoken about location, sensation, modality, concomitant, the Boning essence, classification of symptom, and we correlated that with pathology. That's why I took time to describe you how to understand the clinical pathology in hepatitis, and then we staged it with the clinical symptom. So, essentially our approach was very simple. Signs and symptoms, which is what homeopathy is all, connect that with pathology and then have a clinical correlation and interpret that in terms of susceptibility. I'm sure there have been thousands of classes about susceptibility and what is susceptibility and what is miasm, everything. But when we have to translate that into a research knowledge, it needs to be quantified. You cannot use qualitative, descriptive as a lone parameter without actually trying to quantify it, to convert it into some numericals which can then be compared and contrasted. So susceptibility as described by Stuart Claus, I don't have to talk. There are a lot of senior teachers over here. Me talking about susceptibility is not good, but I'm just trying to touch upon what susceptibility is meant. So Stuart Claus talks about, we mean general quality or capability of a living organism of receiving the impression and the power to react to that particular stimuli. And then the other gentleman who talked on susceptibility is about H.A. Roberts. Susceptibility is a primary reaction as a reaction of organism to the external and internal influences. Susceptibility varies in degree in different patients and at different types, and in the same patient is also varies. So this is the key part, that when you talk about variation of susceptibility, how do you actually quantify this variation? And if you are able to quantify this variation of susceptibility, then you can use this as a mechanism to understand how to manage the therapeutic implications of that. I'll not go to the details of this, but what we did is we built so susceptibility expresses itself. How does susceptibility clinically operates? It operates at three levels. The vitality, it operates through psychoneuroendocrine system, the state pathology and the characteristics. That is why I spoke about the pathology of acute viral hepatitis in detail, so that we can then correlate into all these four systems. So, and susceptibility has its expressions. It expresses through characteristic symptoms and not so characteristic symptoms as the tissue level changes. You can see two expressions broadly of susceptibility. One is exaggerated susceptibility and the second is lack of reaction. Now these are two extremes, but there is something that falls in between, and how do we go about quantifying that is my issue. Morbid susceptibilities, as I said, you can see in this graph, is expressed in two extremes of expressions. One is exaggerated one and one is the diminished one. And this is the correlation between expression of susceptibility and the progress of pathology. So you will see as the pathology progresses, the expression of susceptibility goes down, the amount of characteristic gradually recede. And this is how you will understand how the expression of susceptibility can be graphed in terms of low vitality, lack of reaction, sluggish susceptibility, apparent state of health, hypersensitive susceptibility, idiosyncratic expressions, and finally the anaphylaxis. So you will see two expressions, exaggerated one and the subdued one. So this is how you can graph it up, where apparent state of health is your measure. An apparent state of health is where you start off saying that when there are no acute symptomatology present in HAV, that is your mark 0. That is where you start as counting your measures. Well, I owe this to Dr. Davle, from where I have done my PG as well, and we've gone through his books to understand this quantification. Now, based on this susceptibility understanding, we devised 5 strategies for these cases. One is acute remedy followed by chronic. Second is use of chronic remedy in an acute case itself. Third is use of nosode. Fourth is use of only an acute remedy, not followed by chronic constitutional remedy. These are the 4 strategies that we found out, and this is the percentage at which we had to use it. We did not pre-decide to use it. Based on the indications, we decided which strategy to use, and this is how it fell out. Now, to describe these strategies, I am going to use 5 sample cases to make you understand. It's very simple. I am not going to read the preliminaries, but you understand when you classify your understanding into location, sensation, modality and concomitant, you will see that most of the time you will see characteristic modalities and concomitants coming up in the case. If that is the case, you can clearly, that's why I have marked out those 2 columns in orange. If you see your data is there in those 2 columns, you know that the patient is reacting to the stimuli of the illness and is trying to throw characteristic symptoms, right? Now, in this case, there was thirst increase for small quantities often, and there was profound weakness, and immediately after eating and drinking, the patient had vomitings. Now, the bilirubin was around, the SGPT was around 1500, OT was around 9.5, and bilirubin was just about trying to rise. So you understand where you have captured this case. You have captured this case in the first few days of this thing. So you wouldn't expect bilirubin to be on the top. This is a good time for you to actually go for a, what is called as go for an aggressive kill in this particular case, because you will be able to clearly cut short. The susceptibility is good. The patient is reacting to the stimuli. It is the progress of the disease has not happened too far and too far this thing. So it's good for you to now aggressively cut down on this particular case. I am just giving this slide for the students to understand how you actually go about classifying this. So it's a fast progressive case with sudden onset and has shown good characteristic symptoms, and it's very much in a reversible stage at this point of time. What you do is you repertorize the case. I don't think we need to discuss the remedy. Everybody can guess it's arsenic alp. But what is more important to see is the strategy. This case would not require much of stimulation. You give arsenic alp for a couple of days and leave it alone, right? The case will recover on its own. So you should know which weapon to use at what time, right? You have a needle prick and you can also have a AK-47. You need to know when to use a needle prick and when to use a AK-47. So that's the point that I'm trying to drive home over here. And this is something that you learn when you understand susceptibility well. Again, you see those 2 columns are marked in red. That means the patient is expressing through characteristic symptom. Here, the expression is ineffectual urge for stool, mouth is tasting bitter and vomiting immediately after drinking. Again, I think everybody can make out what this is. Now, why I am bringing this tool here is, this is the tool that we use to quantify susceptibility. We have heard about Roberts, we've heard about Stewart Claus, but nobody taught us how to actually quantify it in a way that we can use it in clinical practice. So this is the tool that we devised to use the susceptibility. We score on the susceptibility. So you will get a susceptibility score at the end of when you do this scoring. And these are the parameters that we use, and most of them are clinical parameters. We are not devising, there's no philosophy here, it's a pure clinical parameter transformed to connect the philosophy in such a way that it can be used in clinical practice. That's the whole idea. And all this tool was used throughout for all the cases in this particular study. Right? So this case, the case that I showed which had ineffectual urging with bitter taste in mouth, everybody knows that you can use Nux vomica in this particular case and nothing. So you can understand that I am talking about simple remedies. I'm not talking about some, rare remedies or anything that is non-available to us in the practice. All I'm trying to drive home is when to use, how to use, and how to manage that particular case. So, what is the strategy that is there for phase 1? If there is good characteristics available which you can know through Bonning-Ussen's understanding of location, sensation, modality and concomitant, and if the pace of the disease is rapid, if the patient is expressing through good characteristics, this is indicative of minimal deviation from the apparent state of health. If you can support this with your SGOT and SGPT, which is as per the expected rise, you know that the disease is progressing as per the expected rise, and there is no exaggerated expression, neither there is a too devious expressions out over there. Once you know this is a psoric expression, and any psoric expressions requires a needle prick. You don't have to bombard a psoric expression at all. You just need a needle prick and it will take care of itself. You just give couple of doses of the indicated remedy and just stay back. Don't put your hand into much more. So the posology used was just an acute remedy. Recovery, in these cases, you should expect that if this case is not recovering within 2 to 4 days, there's something wrong. You're not doing the right thing, right? So these are the cases where you need minimal expression. Just give a couple of doses, assure them well, monitor them for a couple of days, and they will come back and tell you that I'm hell and hearty within 1 week's time. This is what I said. So we quantified the susceptibility, and in this study we found that mild deviation, which is an mild deviation from apparent state of health, was present in around 23% of cases, whereas moderate deviation in around 60% of cases, and I'll come to those cases, and severe deviation in around 16% of cases. And you will see that the expressions and the pathophysiology would change. These were the acute remedies that we used: arsenic, iode, phosphorus, nothing new. All of you know about it, but you should know when to use and how to use. Now we come to the second strategy, that where we use a chronic constitutional remedy in an acute illness. And when do you actually do it? You see, this is what will happen. You saw the earlier cases, those columns were yellow, there were symptoms out over there. In these cases, you will see that there are missing symptoms over there. You will see all common symptoms in location and sensation column. The modality and concomitant column will be empty. What does it tell you? That the disease has gone inside, but the patient is not able to come out with a reaction to that particular illness, and that is all about susceptibility. So when the virus invades, your body reacts, and it reacts in the form of symptoms. And if your symptoms are not exhibiting, there's something missing out over there, and that's something that you should understand. I have not devised anything new. This is nothing to be patented. This is something that is age old over there. We are just understanding how to apply that in the clinical practice, and that's where we come from. Because we are all clinicians first, I believe, right? Academicians next, hopefully, and researchers maybe. So this is something that I want you to understand, that as a clinician, if you know how to apply your philosophy into practice, you'll probably have an edge over others. What do you do in these patients? You simply define the total case of that particular patient. Take their chronic history, past history, family history, whatever we do, and then come to the constitutional symptoms. Usually you will find that these diseases are gradual in onset, right? They have already reached a cholestatic stage. Their SGOT, SGPT has already peaked out. Their bilirubin is now rising, and you will see rise in alkaline phosphatase. If you get a case at this level with no characteristic, don't try to break your head with giving an acute remedy. It will not work. Go straight away for the chronic constitutional remedy and treat the patient. So in this case, we gave Platina. I don't really need to discuss Platina here. I'm just talking about the strategies. Single dose of Platina 200 was prescribed. Please understand, vitality is good. The susceptibility has not shown expressions of characteristics, but there's nothing wrong with their vital organs. Vitality is good. the stage of the disease is still very much reversible. So don't try to bombard it, right? This is typically what a psychotic expression will look like. They can still manage the disease. You still just need to maneuver it a little bit, and it's not a needle prick, but it's like a little bit of navigating that you need to do for this, and leave it alone. And the psychotic cases which are in the earlier stages will still manage to come out, not as fast as the psoric cases. These are the cases which will go into the second week before resolution happens. Your psoric cases should resolve in 2 to 4 days. These are the cases which will go into resolution in up to second week of illness. But if they are not recovering within 2 weeks, then you are in a soup, and then you need to really rethink on your strategy. Similarly, this particular case, you will see the constitutional characteristics expressed during acute. Right? You will see irritability, quarrelsomeness, and thirst decreased has come up here as a concomitant expression during an acute in a case of sepia. Do you realize what I am trying to say? Chronic remedy is sepia, and during an acute phase, the same characteristic concomitants have come up in an exaggerated fashion. Again, don't break your head remedy even though we are treating an acute case. Now that's the second strategy that we have been talking about. Here also you will see that the bilirubin will be much higher, SGOT, SGPT will be already start to fallen down, and you will take around more than 2 to 3 weeks for these kind of cases to settle. So when you assure your patients, if you understand susceptibility well, you will not over assure your patient. You will not tell him 2 दिन में ठीक हो जाएगा. You will have to tell him 2 हफ्ता लगेगा, ये आपको डाइटरी एडवाइस फॉलो करना है, और 2 हफ्ते में 3 बार ये मॉनिटरिंग करना है, तभी हमको पता चलेगा कि आपका सिचुएशन क्या है. Whereas if it was a psoric case which is come in first 2 days, I'll tell him don't monitor, take this, report to me in 48 hours, you will be out of this. You understand, susceptibility helps you give that extra prognostic judgment that we can use during clinical practice. The third is where you see association of 2 systems coming together. Like here in this case, the liver was impacted, and you see a respiratory infection was simultaneously going on. So hepatitis with a lower respiratory infection during monsoon and wet weather. I think everybody can guess a remedy now. It's natrum sulph. So you understand these different patterns. I'm not talking out of books. I'm talking out of what patients tell us. So you see 3 different patterns we've already been able to see. This is the time to introduce constitutional remedy. Again, we use natrum sulph in this particular patient. Again, single dose of natrum sulph. I'm skipping this particular case. We'll come to the last. So this is where it comes to. Sure, we'll do. So you can see now, you don't decide what method of repertorization you need to take. It is the patient symptomatology which gives you that particular state. In this case, in this study, we used Boningerson's method 19%, Kent method 7%, 1% bogus, and 3% of keynotes to prescribe. These were the chronic constitutional remedies used during this particular study as indicated medicine, not as a follow-up medicine. So in conclusion of strategy 2, if the pace of the disease is slow, if you don't find characteristic symptom expressions during the acute phase, and the stage of pathology has not reached extreme, it is still reversible, this is a good time to introduce a constitutional medicine even though the case has an acute illness. Right? This indicates that there is moderate deviation in susceptibility. It is very much reversible, but not with an acute remedy. And this is the last strategy that I am discussing, where you will see severe pathognomic symptoms, weakness to the extent that patient is unable to walk, and the bilirubin has crossed the mark of 20. 20 is your cutoff point. If your bilirubin has crossed 20, there is no simultaneous rise of SGOT and SGPT, then This is the time not to waste time on your acutes. Start use of a nosode immediately. Because you know by this time, as I said earlier, the reticulin fiber network has already in the liver broken down. The liver will start shrinking now. So you want to prevent the secondary damage that is going to happen. This is the time to use nosode. So in this case, we used tuberculinum 1M single dose, followed it up with a constitutional at a later date. I'm not showing you the individual case responses because I've showed you the quantified responses. So around 3% cases require this kind of a strategy. So if somebody asked me what is the dominant issue in acute viral hepatitis, most of us would be tempted to say that it is usually the psoric response. That's not actually the case. It is a movement between SORA and psychosis. That is what we see during the acute viral hepatitis. So don't be tempted to, and you will be surprised to find out we teach podophyllum so many times and it never appeared in our study. So what we teach needs to be streamlined with what we see in the clinical practice. Only around 3% patients require this. You will usually see no characteristic symptoms. The susceptibility and the vitality is very, very low in this particular patient. Do not repeat. Use a single dose of nosode. Wait and watch till they start reacting to it. Once they react to it, that is the time to introduce the next forces. Don't be enthusiastic to kill the disease here. The disease has an upper hand here. So you need to bow down before the disease, allow it to pass off. When you know your enemy is stronger, what do? Right? That's the thing that we need to do. In psoric cases, you know you have upper hand, go for the kill. In susceptibility cases, in psychotic cases, be diplomatic, shake the hand, allow them to gradually come, shake the hand and bring them out of this. Here, completely bow down. Tell them you are the boss, right? Take care of my patient. You are the boss. Let me handle you. Give me some time. Show me those characteristics and then I'll go for a kill. So you understood the three strategies, right? So this is the miasmatic preponderance in these particular cases. What I'm trying to say is that, see what Stuart Claus and Roberts wrote in their times is very much quantifiable and can be used as a research tool. This is the point that I'm trying to drive home because I'm sure there are a lot of PGs over here. So in conclusion, individualized homeopathy is useful in rapidly reducing the symptoms, signs and biochemical parameters, and it cuts down the course compared to the spontaneous recovery with modern medicine. This study demonstrates that homeopathic treatment on an average, I'm talking now on an average, can reduce complete clinical and biochemical recovery time by half. And that's a huge, it's a huge gain for the patient. This is what 83% showed improvement in subjective, objective parameters in 2 weeks and remaining 17% recovered in the next 2 weeks as well. That's what I'm saying. The tall graph that you see is with modern medicine and spontaneous recoveries, and the short graph that you see is after intervention of homeopathy. Now, if you assess susceptibility well, your accuracy rate is 84.3% in this particular case. Do you understand what I'm trying to say? Your best shot is a headshot. That is the sniper's principle. Your best shot is a headshot. What does headshot do? It just kills you in a moment without even you knowing that you are dropping dead on the floor. So for a homeopath, if you ask me, your best shot is headshot and your headshot is your first shot. The moment you are into the second shot, third shot, you are groping in the dark. Your recovery rates will fall. Please remember this. Your best shot is your headshot. Your headshot is your first shot. And if you want to do your first shot well, then understanding these criteria is very, very important. Study demonstrates that it is possible to quantify susceptibility based on clinical and homeopathic parameters. We did not import parameters from modern medicine world to do this. In conclusion, the parameters of assessing susceptibility at bedside in hepatitis covers all clinical parameters, pathological parameters, individualizing characteristics and miasmatic influences. I believe this is how our homeopathic studies should differ from modern medicine studies. I don't think I need to read the rest of characteristics. I thank you for all for giving me this opportunity. I have my full acknowledgement for all of this. Thank you very much.
Thank you, Dr. Naveen.
And now I request Dr. Ajay Dahar, Member Senate, Maharashtra University of Health Sciences and Advisor IAHP to come on to the dais. I also request Dr. Tanveer Hussain sir. Dr. Pankajakshan. I request Dr. Shivamurthy Garu to come on to the dais. I request all I request Dr. Rashid Akhtar, President Iihp UP, to come on to the dais. To come on to the dais. Please give big round of applause. She came all the way from Chandigarh. Please give big round of applause. I request Dr. Anwar Khurshid, Vice President, Saudi Arabian Healthcare, to come onto the dais. Please. I also request Dr. Mahajan to come onto the dais. Dr. Mahajan, Past President of IAHP, Maharashtra State, Dr. Mahajan. Dr. Mahajan. Friends, thank you very much, sir. Request Dr. Manik Prabhu, Organizing Secretary, IAHP Telangana. Please, Dr. Now I request
I just want to thank the introducing me and also uh, thank the organizers to invite to this conference. I have to make a confession first. I am not a homeopathic doctor. For that matter, I don't practice any kind of medicine. You might ask, what the hell you are doing here? I tell you, that's a question I asked myself, but because of a couple of people, homeopathy practitioners such as Dr. Rao, Dr. late Srinivas Rao, Srinivasulu, and Dr. Gupta, and several other people made me think what homeopathy can do in these things that I'm interested in it. I'm interested in rare diseases. I bet many of the students never heard the word rare diseases because it's not in our curriculum. Nobody has ever taught anything like that. So before I go and what the connection between the rare diseases and homeopathy, how it can help the people, the diseases, etc. So what I try to do, first of all, I will explain to you a little bit what rare diseases are, and then I will try to connect the alternate medicine as a homeopathy. In that sense, first of all, is what is rare? Rare means obviously you can see that it is not a common disease. Everybody knows what common diseases are, but very few people know what the rare diseases are. Okay. Now, in this particular case, there are many definitions. As you go by, I will let you know. But for the time being, just to take it my word for granted, that rare diseases are really rare. You don't see them often, but they are everywhere. And here are some things that I can try to, as briefly as possible. Majority of the rare diseases are genetic disorders. And just before I go further, this morning, I have had excellent presentations, but there is something missing in it because you don't care what name it is. You are just treating it. That's a big difference between a homeopathy and the allopathic medicines. And now I try to explain to you what rare diseases are. Majority of them are genetic disorders. They occur randomly sometimes, and sometimes the families can have it. Most of the rare disease patients are children. Majority of them, they don't even see their fifth birthdays very often. 60% of people are children. Many, sometimes, occasionally, the rare disease appear in adults, 40, 50 age that time. Unfortunately, these diseases have very, very few treatments. Okay, here is some numbers. There are more than 7,000 rare diseases are there. Interestingly, every year more than 250 rare diseases are added. But if you go back and see that 7,000 number does not change, for some reason it just keep going the same number. And 80% of rare diseases are genetic origin. And 50% of rare diseases that affect children only. And percent of rare diseases patients die before they reach, unfortunately, 50th year. Now, 10% of adults worldwide affect the rare disease. That is a lot of numbers. That includes the patient as at least one parent. That includes a lot of numbers there. Now, here is a some way of, where rare disease patients are in India. These are not exact number, but there are more than 300,000 lakhs of people. That means 30 crores of people there in worldwide rare disease patients. One third of them are Indians. That's more than 90 million people. That is 9 crores of them. But you don't see them often because you don't know how to identify them. And most of them they don't come out and say that I have this rare medical condition. And definition of what rare is, we'll come back to that one later in a minute. I'll try to go. The frequency of certain rare diseases, multiple sclerosis. Some of these names that I have listed here, you might have heard it, or at least you know some of them here. Here is the frequency of certain diseases. In this slide, you can see multiple sclerosis. 90% people per every 1 lakh percent, you will see it. That's a large number. As you go down, you can see some diseases only less than 1%, 1 in 1 lakh. That means in worldwide, there are more than only less than 200 people with that kind of diseases. They are called ultra rare diseases. So now what we are doing it, the Indian Organization for Rare Diseases. In brief, I just go very quickly. It was established in 2005. It, as a registered as non-profit organization in US as well as in India. We have only one paid staff. All are volunteers. More than 1,000 signed patient organizations. 8 patient organizations signed up. And in the presence of 9 out of 29 states, we are there. You can find this information from various other cities that we have been doing it. Okay. Now, without patients, we have no mission to accomplish. What is our vision? Rare disease patients should have equal opportunities with those patients with common diseases. For that, our mission is to provide support to rare diseases and patient groups. Organize, develop, connect patient to patient, researchers to healthcare providers, policy makers, drug developers, and etc., etc. And lastly, learn from the international rare diseases support groups and disseminate the information to our patients, because the world has been spending a lot of time and resources for rare disease more than half a century. We just started in India. Okay, and there are several national and international organizations are there. Just to give a list of things, here are the USA has got several of them. Europe has, there are international organizations. That means several countries got together and become one organization. Rare Disease International, Asia Pacific Alliance for Rare Disorders, depending on what regions they come, and International Rare Disease Research Consortium, International Conference on Rare Disease, and several other things are there. The point I'm trying to make here, where are we? We meaning that India. How can we reach to those level? Okay, now that's a global perspective. That's the global public health issues affect few people, but cumulate effect on public health. It's a variable definitions, basis for population affected. Let me skip this one. Here is the definition for rare diseases. Every country has got their own. I like to point out one thing. India, for example, has the one in 2,500 people. Actually, India does not have any definition. Yes, SEMR defines one way, CDSA defines another way. However, the World Health Organization has a definition of its own. It's a fixed number, whereas the Japan has a fixed number. Rest of them are incidents. That means as the population changes, the number changes. But in India and Japan, the US and in Japan, they don't change the numbers. They say same thing. You might ask, why do you want the definition? We'll come back to that one later. And in the same global perspectives, in 1980s, US is in the same situation as we are today. But over the years, because of their interest and energy, whatever, they made lot of progress and they became example to other countries. And the first time they had the Orphan Drug Act established in 1983. I'll go through that one if time permits, otherwise just take my word for granted. That is the beginning of the rare disease movement in every country. Several countries have started the similar things, and there are national plans in other countries, including in India, we just started in 2017. So rare disease policies are in several countries in the same token established it. There are several in the policies. One is how to formulate national policy, how to diagnose the rare diseases, what is the care coordination, and how to promote the research, patient engagement, etc., etc. Okay, now coming to the Indian perspectives. There are many diseases you might know, but some of the diseases that I just want to point out to you, hemophilia, I'm sure that some of doctors here sitting, they are treating the hemophilia patients. And sickle cell anemia, India now decided they want to eradicate this sickle cell disease from India. A Pompe disease, another one, cystic fibrosis, etc., many other things. Now, Indian policy has a timeline. You can see that is first at 2017, just about 7 years ago, whereas the other countries have developed long, long ago. That too, in 2017, the first national policy came into the existence. Why? At that time, the government has the responsibility to answer the Supreme Court, High Court in Delhi. So they forced to drop the policy. That's why they drafted in a hurry 2017. But unfortunately, it didn't do any good. So again, they modified it in 2018, and still that did not do any good. So keep on doing until in 2020, they drafted the national policy and asked the experts committee to review it and take the suggestions, and then came up with a real one. At least now it is in existence. That was approved in 2021. We'll go through that one, what that is. Now, rare disease classified into three groups. And one diseases that are amenable to one-time high-cost treatment. This is I'm examining the policy that was written 2021. There are some diseases listed in that in this group. Another class is low-cost lifelong treatment diseases, food, nutrition, supplements, etc. And the other group is high-cost lifelong treatment patient selection. Gaucher disease, Hunter syndrome, Duchenne muscular dystrophy, etc. of these three different varieties. Well, here is something I wanted to show you. All these groups have got different benefits or different incentives the government has given to you. Group 1 disease will get, supposed to get 60 lakhs support from Rashtriya Ayogya Nidhi. This 20 lakhs were in 2021. Now they increased it to 40 lakhs support. And it covers the beneficiaries include bottom 40% of poor and vulnerable. Okay, so I got the notice, so I'll try to finish it as okay, Indian policy perspectives, there are quite a few of them are there. Preventive strategies, establishing centers for excellences. They keep on adding, but where we are, we don't know. Still going on, and others develop. And how I am talking about the alternate medicine to Iihp perspectives only. So drugs and orphan drug homeopathy, until we actually introduced the word orphan drugs or rare disease to homeopathy community in 2016. Until that time, it did not exist in the literature of this. India is the epicenter for traditional forms of healing. The government aims to position India as a destination for health and wellness tourism through Iihp system. Homeopathy is a part of the Iihp system, as you can see that. India is actively integrating traditional healing in the health system. Here are several other integrated approach to address the healthcare in our country. National Iihp Mission, implementing national programs of prevention, research studies for standardized protocols, etc. Now, Global Iihp Innovation Summit was conducted in 2020. Later on, the government has also established a dedicated Iihp center. Now, recently, Global Center for Traditional Medicine was formed in collaboration of Ayush and WHO. It aims the use of modern technology and traditional medicine, etc. Now, role of homeopathy and rare disease, what is that means? And if I talk anything about homeopathy, it's like a teaching prayers to the pujari. So I just skip this one. And there are certain challenges of homeopathy, at least in the relevance to what we are talking about. one good thing about the homeopathy is individualized medicine. It's a mass treatment. It's not. Whereas allopathic is always think about the mass production, Now, recently, because of genetic reasons, many of the diseases are becoming personalized medicine. This morning I saw they're all personalized medicines. They are not a mass production. Mass cannot be treated. Unfortunately, homeopathy in rare diseases, there is a lot of room there. Here are something, they are sometimes they standard on treatment, sometimes they are in combination with allopathic in other treatment. What does it do? Either they enhance the treatment efficiency or reduce the side effects. This is the alternate treatment. Patient not responding to primary treatment and palliative. I have seen many times people go to homeopathy only when everything is exhausted. Many times they get better. Now, here is the thing I'd like to, 1 minute. More than 7,000 rare diseases are known, as I said, and many more are being discovered. Only 5 to 7% of rare diseases have treatments in the last 40 years. Now, at this current rate, it will be 2,000 years before every rare disease has an approved treatment. Remember, they are only treatment, not cures. Now, how can a process be performed so that more treatments are made available in a shorter period? Ample room for alternate medicine. Homeopathy is one of them. Now, there are several research papers are there. I'm not going to through that. Here is another genetic related publications, and there are a lot of other workshops are done. Here is the take home message for you all. Homeopathy is a large scope for rare disorders. Lots of doctors treating rare diseases all over the country. I've seen this morning 3 or 4. They don't have any names, but they are treated, they're cured. Rare disease awareness has to be enhanced in homeopathy community. Trying to document the stream carefully. Let this small rare disease community know that they are not alone and we are with them. Thank you.
And I request him to come onto the dais. Dr. S. Venugopalachari. Thank you very much, sir, for coming all the way from USA, for presenting a very good topic. Thank you so much. I request Dr. Venu from New Zealand to come onto the dais. Thank you, sir. Whenever we have problems, he is there for us in Telangana and the twin states of Telugu states for helping us. Give him a big round of applause. Dr. S. Venugopalachari is always there for all of us in favor of homeopathy. Thank you so much, sir.
Dr. India, especially Telangana, which is especially Hyderabad, which is happening city. And in India, because most of the eminent personalities from the USA and other countries also, before commencing that National Homeopathy Scientific Seminar, and I congratulate all the dignitaries and President, executives of the National Homeopathy Scientific Seminar, Hyderabad, in association with the Homeopathy Medical College in Telangana. Really, I feel very privileged for participating. Yesterday, actually, I wanted to come, but due to some political scenes and especially commencing assembly, I could not able to attend. Really, it's a great privilege for me for participating in this. Most of the, I think, eminent homeopaths are here from abroad and India. Actually, what we are lacking, I think most of the yesterday speech, they might have delivered you about the research, necessity of the research in homeopathy. I really feel sometimes because in some countries, especially in England, Australia, the government, respective governments banned the homeopathy. I don't know the reason. Here also, whenever the Indian Medical Association or somebody will complain against the homeopath doctors, because homeopathy textbooks also, whatever the allopathy students will read in their colleges, homeopathy students also read same thing. Anatomy, biochemistry, physiology, pathology, SPM, psychology, what are the subjects taught to the allopathy? Homeopathy students also will know taught in homeopathy. In addition to that, we have Materia Medica and Philosophy Organon, especially. And peripheral postings also, allopathic hospitals also, the students who completed homeopathy, they have been posted in the peripheral hospitals pertaining to allopathy only. So in Davidson Medicine, you see, almost all etiology, clinical features, pathology, finance, everything there, and little bit 4 or 5 lines is the treatment part is there. But treatment part, our professors will not teach. Materia Medica symptoms, Materia Medica drugs only, whatever applicable to the disease, they will try. But we will read now. After reading from etiology to clinical diagnosis, naturally we will read and we know the medicine, what the medicine using for this medicine in allopathy. So that's why we are both in allopathy and homeopathy, we are experts actually compared with other medicines also. As a homeopath, sorry to say, after completion of my homeopathy also, I started pure homeopathy in my Nirmal. I hail from Nirmal, Hyderabad district. Before becoming MLA, I practiced homeopathy. 3-4 months I practiced regularly. Hardly we able to get 4 to 5 patients. So 4 to 5 patients I used to give the medicine, homeopathy medicine, and the remaining days for placebo. Generally the patient ameliorated and they will be cured with the medicine. But after some time, after 1 month or 1.5 month, psychological stress started to be for patients. I been to the rheumatic pains, doctor given medicine. And I been to for fever, the same medicine is given to the fever, same medicine given to the body pain, same given to etc. etc. Because most of diseases, 90% of disease based on the psychological only. Psychological stress and strain and physiological symptoms, stress and strain only, the symptoms will come. Once the talk discussion like that, same medicines will give to all the patients, all diseases. Slowly, patients reduced to 1 or even sometimes I faced just sitting. తెలుగులంతా ఈగలు కొట్టుకుంటూ కూర్చుంటాడని చెప్పేసి సేమ్ థింగ్ హ్యాపెన్. సో దెన్ ఐ స్టార్టెడ్ allopathy. At that time, epidemic prevailed in Nirmal, gastroenteritis. And before practice at Nirmal, I served as a housemanship. I got distinction in anatomy, so that the government they given privilege to work in the Usmania hospital. So I taken the night duty. Naturally, I night duty almost all serious cases, all poison case, everything. So by that I started allopathy. So then Saturday, Sunday, I started homeopathy. After becoming some permanent patients or some saturation, then I started homeopathy only. But sometimes I got question that how your medicine will work. We will telling based on the similar curanter, plane, dynamic plane, everything is there. But how it will work? They are showing how the remedy will work in allopathy, whether it is any calpol or any antibiotic, megantin or any antibiotic will get. They will show the cycle, how it works. But we are lacking in that. So research work is important in homeopathy for uplift of the homeopathy. This is a request to all the eminent dignitaries, because we are lacking in the research only. Because allopathy lacks of some 1,000 years of the system, but we are lacking the research work. I request all the eminent personalities, those who came for the seminar. In that era, I think yesterday some officer, some dignitary, some doctor has expressed about the research work in necessary income. So, this is a research oriented, a must learn process, because since past 200 years we are using, but we are lacking the research work. In research reality and a complex of certain things, I request all the eminent personality and I request medical college in Telangana and also National Homeopathy Scientific Seminar. In that era, we have to do, and from government side, because Ayush giving lot of emphasis for Ayurveda, not homeopathy. Ayurveda, they are giving lot of emphasis, but fortunately, our homeopathy system is included in Ayush. So we are showing that progress. This is false. So once if homeopathy will rise in the world, we require orientation, we require the research work. I request all the dignitaries, you come in that way from government side, because and no doubt we are in the government, whether central government or state government, we are ready to assure and ready to provide everything. Those who do work in the research, we want to establish research centers also in private college, gyms and also GHMS in Hyderabad, and completely you can use my services for establishment of research. Thank you, one and all.
We're all waiting for your presentation because it is a very important topic. Role of homeopathy in abuse in pregnancy leading to autism.
Good afternoon, everybody, and I'm very happy to present this topic because this is a part of my research nowadays. I've been working on autism for the last 15 to 20 years, and recently I have been stressing about role of mother's health and mother's stress during pregnancy and how it affects the child. So I have a clinic in Istanbul, Turkey, where I see a lot of children, and we have around 150, 200 children whom I see there every 2 months. And the kind of histories that I get is that there is a lot of abuse during the pregnancy. And that takes us back to the Indian culture and tradition all over, that when the girl is pregnant or when the woman is pregnant, she is supposed to go to her mother's place around 6th or 7th month. And that takes me again yesterday when we talked of the second trimester. What is synaptogenesis and what is pruning of synapses that occurs around that part. So how the Indian culture and traditions are admixed with scientificity, that tells us the importance of autism here. It's not only that autism can occur, but any other problems can occur due to this problem around the second trimester or the third trimester. Remember that. So the woman should be happy. She should not have any stress. She should see happy pictures. जो खाना है वो खाइए, जब भी उठना है तभी उठिए. That is how she is treated when she is pregnant. So it's a real precious time when she is pregnant, and she has to be treated specially. But are these women treated specially? No. There is a lot of trauma due to so much of frustration, so much of strain, so much of what's going on in today's world. That's everybody so busy, and she is working till the 8th or 9th month of her pregnancy. We in Bombay, we see that the local trains are loaded with people, and in the ladies compartment, you see pregnant women who are 8 months, 7 months, 9 months pregnant, who are still going to the office, working whole day in the office, coming back, cooking, and still they are delivering after 9 months. Many of them are lucky to get normal children, normal delivery, but many of them are not. So this is what my study is all about. So role of homeopathy in abuse in pregnancy leading to autism. So did you know around 30% of domestic abuse starts around pregnancy, and 9% women are abused during pregnancy or giving birth. The ACOG says that 1 in 6 women is first abused during pregnancy. More than 320 or 320,000 women are abused every year. By abuse, I mean they are hit, emotionally abused, physically abused, sexually abused, financially abused. Okay. Adverse perinatal circumstances have been associated with increased risk of autism. Women exposed to childhood abuse. Now, this is yet another thing that I'm studying on, that those who are abused in the childhood also, they have chances that their even children can get autism when they are pregnant, even if they are not abused during the pregnancy. Exposure to IPV, that is intimate partner violence in the prenatal period, has been associated with high risk of autism. Exposure of high levels of both sexual and physical emotional abuse could be associated with autism. So autism, as you all know friends, is a neurodevelopmental disorder that profoundly impacts an individual's communication abilities, social interaction and perception of the world. The neurodevelopment disorder refers to a condition that affects to the development of nerves or neurons. That takes us again back to the synapses which are formed around the second trimester, third trimester, and slowly up to 2 years there is a pruning of synapses. That means cleaning of the synapses. So if this cleaning of synapses does not occur in the natural process around the second, third trimester, there are chances that a baby can develop autism. And this is the time when the woman should be really happy, should be really stress free. And any kind of stress, any kind of abuse can lead to no pruning of these synapses and cause autism. So it's very important. That's where homeopathy will work. Homeopathy acts at that level. Remember that. Okay. So the delayed or absent pruning of synapses is the basic problem of ASD, that is the autism spectrum disorder. When you're pregnant, your baby is exposed to everything you experience. This includes the sounds in the environment, the air you breathe, the food you eat, emotions you feel. When you feel happy and calm, it allows your baby to develop in a happy, calm environment. However, emotions like stress, anxiety can increase particular hormones, especially cortisol, can affect your baby's developing body and brain. All physical and emotional changes experienced by women during pregnancy cast a big influence. During this period, the child himself or herself has not seen the world, but he or she is feeling and perceiving or sensing it through the mother. Hence, it is essential to understand how the mother thinks, feels, perceives, and senses herself in the pregnancy period. Let's go to a case of an adult autism. His name CK, age 24, male from Turkey. Okay, I will just play a video quickly. Can we have the sound, please? So this is an adult case of autism. I am treating quite a number of adults who are suffering from autism. But this all starts from childhood, remember. A case of 2021, verbatim of the mother. He has rigid routines like walking to the sea, driving him to McDonald's every day for so many years. Remember, the mother has to take him to McDonald's, drive 50 kilometers up, 50 kilometers down in the car every day. These are the rigid routines of autistic children, remember. He spends all his day watching cartoons from different tablets at the same time. Now, this is the autistic seventh kind. That means the intelligent autistic children. Remember, there are certain population of autism children who are very intelligent. More intelligent than our so-called normal children, remember. He's picky eating. He eats only pastries, sweets, chocolate, etc. Third one is his colon issue. Fourth one is that he's withdrawn, very violent. You see that he hits himself badly, and if he is angry, he can even attack me. That's what the mother says. Otherwise, his perception is good. He is able to talk but does not prefer. He learned to write and read on himself. He can read many languages. He has been using computers. So see the kind of cleverness or intelligence they have. He is sensitive to disapproval and criticism, becomes agitated and takes a while to calm down. His regression. Now this word is very important. In autism, certain children go up to a particular level and then they start regressing back. And that's where homeopathy takes an important place. That's where we know never well since a viral infection, never will since a death of a parent, never will since the grandmother died, never well since your pet died, never well since you change your place, you change your school. These are the important causations that will lead us to the remedy, remember. When he was 4, his father left us for another woman and he has a daughter from her, but they split too. He's very loud, angry and aggressive. So this child has suffered all this when he was growing up, remember. He would not sleep till his father was not present. My son lost everything. He is very upset when I criticize him. He gets anxious. When the mother gets angry, he receives lot of love and affection from mother. His mood changes. When pregnant, I had to stay at my mom's house. She always complained to other family members about me and nagged me about sleeping too much. I was very sleepy. Both my parents were very, very negative, nagging, disapproving, critical. Here you see the same quality in him, that he has also developed the same quality like mother. And that made me think that probably the mother's remedy and the child's remedy could be the same, remember. She always favored my younger brother. Even my grandmother took her side. Eventually, she asked us to go out. So this woman during pregnancy was thrown out of her home. So what is the core feeling of the case? We are just going fast. The core feeling is 4 seconds, which is very, very common in these patients, remember. Deserted, despised, looked down upon, abandoned, repudiated, thrown out, unwanted feeling, separation, conflict, and outcast feeling. So these were the rubrics I selected from the synthesis. Ailments from grief, 4 second, isolation, delusion, despise, unfortunate, repudiated, destructiveness, and unfortunate. And you see all the rubrics of the mother and the child are corresponding. So could you please tell me what the remedy is? Yeah? Staphysagria, yes, okay. Anybody else? Even I thought of staphysagria, magnesium carb, lysine, because there is a lot of self-violence here. Okay? Staphysagria will not be violent on himself. Staphysagria will throw things, remember that. Okay? So I found out a remedy which has a feeling like this lady. This lady was thrown out. She was abandoned. She was considered as she was absent. And that's how a leper is treated. A person who has got leprosy. He is looked down. He's said, see, a ganda aadmi, isko haath bhi nahi lagana, usko dekhna bhi nahi. And therefore the remedy corresponding to leper is Pura Brasiliensis. So this was the first time I used this remedy, and I gave it in 30 potency because that is the only potency I had at that time. I gave him 1 dose, and after 1 month, surprisingly, his obsessions were better 75%. But still there was rigidity of thoughts. He started interacting with his mothers and others. His irritability, violence is better. He is not hitting himself. Screaming has stopped. His stools are better. So not only the physical generals, but physical particulars were also doing well. His stamina was better, but his routinism still remains. Remember, going to McDonald's every day, seeing so many tablets together. So this thing. Again, 30 was repeated, and he has been doing very well. So I don't want to go with the total follow-up. He's calm now, interesting in interacting with people. Placebo now given for 3 months, still under my care and doing well. I'll just show you how he looks like. He's lost some weight also now. So you saw how he was before, how he was so violent, and now he is calmed down, which is the magic of homeopathy. Right? One more. See how intelligent he is. Now he's watching his changing channels.
Well, there's the darn truck. It's time to go to the bar. I don't want to be ruined today. It's not my fault. I'm just taking care of.
So the thing is, even if we can't cure them completely, we can at least make them productive. Many of my adult autistic patients, they have started going to groceries, learning how to use money, going out on their own, becoming independent, not depending on their mother. Because the mothers are already so tense that who is going to look after my child once I die? So what homeopathy can do them is as to at least make them productive, make them creative, put them into the society as productive members, right? Thank you. Similarly, there was an earthquake in Turkey many years back, and this patient, she was pregnant and there was fear. So another topic of research is trauma. It's not only abuse, but trauma is also fear, remember that. So a lot of fear during pregnancy itself can. So she was 6 months pregnant, fear of fright remains. She still develops palpitation. Her child is 4 years now, and he has the following traits of no speech, no eye-to-eye contact, he is in own world, withdrawn. Now these are the common symptoms of autism. What we have to see is what are the other symptoms that characterize your child. First thing is she said that he is content. उसको कुछ जरूरत नहीं है, एक जगह पे बैठ के खेलता है, मजा करता है, उसको कोई प्रॉब्लम नहीं. इवन डॉक्टर के पास जाता है तो इंजेक्शन का उसको कोई पेन नहीं होता, वो खुद ऐसे हाथ सामने कर देता है. So I saw that the mother was also in the opium state when she was during the Turkey earthquake, and even the child is born with opium state. So this was another case where I saw the mother and the child's remedy was corresponding. So opium she did again in LM potencies. He is doing very well. Another case was anacardium, where the father was very, very humiliating, abusive, alcoholic. And there were a lot of fights during pregnancy. The father hit on her stomach also. So much violence was there. And the child now again born has the same traits of anacardium, like cruel. The mother said कि एक cockroach देखता है तो उसको पैर से ऐसा crush करता है और खुश हो जाता है उसको. So those are the traits which come from the mother to the child, and this is what we have to still do a lot of research on. Okay, so these are I was looking at the remedies for abuse, and my next work would be role of carcinosin. Remember, carcinosin is a very, very important drug for autism with a history of abuse in the mother. Remember, so we have to see these patients in our practice, right? So ailments from abuse, fright, indignation. These are the rubrics that we have to select. Grief, neglection, ailments from shame. Remedies, my most common remedies coming after trauma or abuse. Stramonium is number 1, opium, carcinosin, lac humanum, lycinum, where there is a lot of violence hitting yourself. Hyoscyamus, of course, magnesium carb, anacardium, and hura. Okay, these are some of my studies that I have done. You see that sexual abuse around 17%, financial 10%, psychological 18%, physical 20%, and verbal abuse is around 35%, right? Common remedies that I have seen: anacardium, lac humanum, opium. Carcinosin is one of the most important. It can be 25 to 30% carcinosin cases, remember. Thus we see the effects of abuse on the mother has a damaging effects on unborn fetus and can lead to various birth anomalies and also learning and behavioral defects. Homeopathy has an excellent scope in autism, and if we get a positive history of trauma or abuse in the mother during pregnancy, we can surely get the simulacrum and heal the child of autism. Thank you very much.
My too also. Pre-lunch session was very fruitful session, I can say. We had 3 very good and seasoned speakers. The first speaker was Dr. Naveen, who is well known to you, and he has presented very logically clinical cases of hepatic problems. What I learned from that is how to correlate the homeopathic philosophy with the practice. The susceptibility, the sensitivity, how to assess the doses, the symptoms. Because he has very well concluded that everything depends on susceptibility. The expression, the picture of disease, the totality, and then how you tackle that totality with your medicines. So Dr. Naveen, it was very nice presentation, and I too learned from that. Finally, what was very useful is your susceptibility assessment tool and susceptibility quantification. That was something very appreciable. And it has many references, that is how individual comes with his own research, which can be useful for the whole system. And he has shown like acute medicines as well as the medicines like platina and sepia, how they are useful in chronic cases. Because sometimes we classify acute remedies and chronic remedies. No. The indication tells you when to give which medicine and in what doses. So thanks again. Second, we had Dr. Ramaiah. He has come all the way from the USA, and he has presented rare diseases challenge to the world health. Appreciable because he has collected a lot of data from various sources, and he has also described the role of homeopathy, but he didn't have much time. But what I can say is, sir, you have stimulated the interest in that area, and I think all the participants will have interest and will look into that and will take care of that. Dr. Shamir was the last speaker, and he had shown the role of homeopathy in the abuse in the pregnancy. All cases were very well classified. You have seen the video, interesting. Dr. Samir, what I suggest is the change of, rename the topic. Role of homeopathy in abuse in pregnancy. If somebody sees only that, it looks little different. I suggest, it's my request, role of homeopathy in the treatment of autism due to violence during pregnancy. And everything was well explained. You have shown some new remedies, Hura and Lac Humanis. Lac Humanis is one of the medicine which is very well coming up in the study. So look into those medicines because they are very useful. Thank you. And you have also come out with a group of medicines which are really useful in treating autism. So I thank all the three speakers which has really enlightened us, and all the participants I think are benefited by that. Thank you all very much.
Thank you very much, sir. And now I invite Dr. Samir Chaukar, sir, onto the dais for felicitation. I would like to request Dr. Santosh, sir, to come onto the dais for felicitating Dr. Samir Chaukar, sir. And also Dr. Muktinder Singh, sir, Chairman, Scientific Session, IIHP Central, to come onto the dais for felicitation.
Friends, these are my two Anmol Ratan. Doctor, sorry, sir. See, he is Dr. Muktinder Singh, scientific, he is chairman for our scientific committee, national body, who is looking after all the scientific programs nationally. And he is Dr. Santosh Kumar from Abu Dhabi, and he is looking after all the missionary work, propagation and promotion of homeopathy. So, ये मेरे दो अनमोल रतन, एक है राम, एक लखन.
Dr. Samir Chaukar, sir. I request Dr. Deepak Babu, IIHP Karimnagar, Dr. Hari Krishna, Vice President, IIHP Telangana State, to come onto the dais. I also request Dr. Vaidehi, Dr. Annapurna, Dr. Sarita Savarkar, Sneha, Dr. Predarshini, and my friend Dr. Srinivas Gupta, Chairman, Star Homeopathy. I request Karimnagar team, IIHP Karimnagar team, to come on the dais. Dr. Manasa from Karimnagar. Warangal team, IIHP Warangal team, to come onto the dais. IIHP Mehboob Nagar, IIHP Nalgonda, IIHP Khammam, Dr. Narsimha Rao, MVL Narsimha Rao, sir. డాక్టర్ మిరియాల కృష్ణయ్య గారు, వరంగల్ డాక్టర్ పావుశెట్టి శ్రీధర్ and team. I request Dr. M.A. Rao sir to come on to the dais.